Dr. Anand Saxena sir as next speaker. Topic overcoming nucleus management. Saxena sir.
Thank you, sir. To prevent mismanagement, the best thing to prevent the odd situations, and there are few factors one should understand that what can be the factors behind this is the machine related and most important soft nucleus and hard nucleus. Machine related problems are now less as the very good machines are available with good fluidics. Of course, the old phaco tips are definitely giving the problem in occlusion the nucleus piece. Blockage in the circulation is often do occur when we reuse the tubings multiple times. It's better to use the disposable tubing and cassettes. You can see very well uh, the, on the right side the tips are new tips are very good edges, while on the left side these edges are ragged. If you see the lumen of the old tips, there are a lot of deposits and irregular, which give definitely the problem in the suction and occlusion of the nucleus piece. We have to use the cassettes, and you might have noted in so many wrappers of the tips that it is for the single use. It's written in the top of the packet of the tips. Sorry. This is for the soft nucleus. If you achieve the multiple rings like this, multiple golden rings, then everything becomes very easy. Sorry. Can I help someone? ये दूसरा होगा, अब सही आया शायद. Yeah, in the hard nucleus, one should be very careful for the posterior plate. It is my first concern that it should be properly, the plate should be braked. We should be very patient, no any jerky movement, rotate preferably bimanually, and take care in the separation of the posterior plate. It's a very hard nucleus. We have to take all the care for the posterior capsule. Don't go very deep. Don't press it posteriorly. Just side by side. You have to keep full patience, and you can achieve a good separation. Also in the direct chopping, you can have the problem that you are unable to crack the posterior plate, and while doing the cracking it, you may create lot of unwanted problems. You have made the so many pits in the both half of the nucleus. I am trying to rotate using the multiple side to create a separation between the both the nucleus. There is very thick posterior plate. See, this is another pit I have made, and really it is very difficult to remove this large nucleus from the capsular bag. So what to do? I usually clean the entire chamber, remove the EP nucleus, and re-inject the high whisker, remove half of the quadrant, pull it to the posteriorly, and do the vertical chop. So a small piece of the vertical chop debulge the nucleus and make the space for further phaco. See the how to crack properly. So this is the hard nucleus. Have a good patience, no pressure on the posterior side. Our goal to remove every strand of the nucleus separate. See there are fine strands. In the hard nucleus, this is the last piece of the big quadrant. So here I take the two main things. I have to prevent the posterior capsule as well as the corneal endothelium. So I inject the heavy viscous in the bag also to push the posterior capsule posteriorly and anterior to nucleus also. So by this way we can save the cornea as well as the posterior capsule also. This is the case where you see this is very ragged, no smooth surface to occlude it. So I pull it mechanically in the center and make it upside down. The posterior area is the very smooth and can create a good emulsification.
Sir,
In
could
the
you
soft
summarize,
nucleus,
sir?
if you achieve this kind of situation, then the things become very easy. Here is a soft nucleus where what we plan to remove the pieces of the soft nucleus by the EP nucleus mode, bring it to in the center and then emulsify it.
Sir, can we speed up the video or summarize because we are running
Yeah,
short of
sure,
time?
sure,
Thanks.
sure.
Thank you.
Here is a big saucerization in the center. I have to expel it with the visco expression is done. We remove it and bring it to the center. So it can be emulsified fast. It is an old technique of the flip chop where we just hold it from the corner of the nucleus, bring it in the center and then chop it. You see like this we can do the complete flip and chop technique.
Is the next speaker ready?
So this is the take home message. Good pre-op assessment. One should keep all the problems in mind to master all the ways and tricks to manage the situation, and experience will teach you how to manage the overcoming the nucleus management. Thank you.